Welcome everybody to today's 1 Million by 1 Million Strategy Roundtable for Entrepreneurs. We are here every week, and many of you have been with us here week after week and at least drop in from time to time. As you know, 1 Million by 1 Million's mission is to help 1 million entrepreneurs reach $1 million in annual revenue and beyond, and thereby build $1 trillion in global GDP and 10 million jobs. It is a very ambitious, audacious mission, and really our entire justification for existence is to serve your purpose of becoming successful entrepreneurs. We become successful as a company if you become successful as entrepreneurs and build real solid revenue in your ventures. That's the whole equation here. This is our 169th roundtable, and our friends in India at ProductNation share our values of, the desire to see India evolve as a product industry, product-based IT industry, as opposed to what it has been over the last several decades, which is a service-based IT industry. We are seeing a lot of product companies in our program. We have a lot of product companies. We have a lot of services companies that are bootstrapped using services. So, those are all, good signs in the right direction, and we definitely want to encourage that movement of seeing more and more new product companies in India. This is our 169th roundtable, by the way, so that's, quite a lot of roundtables, as you can see. Before we get started with the formal presentations, very quickly, 1 Million by 1 Million has a partnership with SAP's Startup Focus program. And if you are developing, if you're an entrepreneur developing on the SAP HANA platform, you do have an opportunity to become part of the SAP HANA 1M1M partnership. SAP is awarding 12 scholarships to the 1M1M program, one-year program, and you would be, qualified if you're developing on HANA to apply for that. The deadline for the application is April 19th, so please make sure your applications are in. The URL is on your screen. Maureen can also give it to you on the public chat. But if you go to this URL, you will find the application forms and the details of the contest. Okay, the recording of the event will be available on the blog as well as later on YouTube. Few quick pointers. Our Twitter handle is @1M by 1M, and also my handle is @Sramana. If you want to follow us, those are the handles to follow. If you're live tweeting the show today, which you're most welcome to do, please use the hashtag 1M1M. And if you want to subscribe to our roundtables on the roundtable recordings on YouTube, that's @1M1M Roundtables. On that channel, we also have a whole bunch of, basically all the roundtable recordings eventually become available there. And we have a lot of cartoons and, some recordings of my various speeches in different places, as well as the 1M1M FAQs. So it's quite a rich, content-rich channel if you want to spend time there. Today, as we are working with the entrepreneurs, there are 5 entrepreneurs standing by to do their presentations and have interactive discussions with me. But also, if we have time, we will open the line for you to call in and have quick chat, Q&A sessions. For that, the phone number will be 650, country code 1, and then 650-479-3208 is the dialing number, and the access code is 294635963. So make a note of that. Maureen will give it to you in the public chat as well, and we will, call you if we have time later in the session. We're going to start with Jagadish. Jagadish, if you could unmute your line and come tell us what you're working on, that would be wonderful.
Yeah, I hope I'm audible.
Yes, we can hear you.
Good morning, Sramana. Thanks for this opportunity to be able to speak to you. And Thanks for the opportunity to be able to pitch this session.
What is the name of your company?
We are Brahmi Right Technologies. We are a 3.5-year-old company specializing on the Oracle solution side of things, specifically financial management, supply chain management, human capital management, project and knowledge management side of things.
Okay.
We have a 30-strong team based out of Bangalore and Delhi NCR. Logic Blocks is our key product initiative on the knowledge management side of things, and it caters to both the SME as well as the enterprise customers.
Okay.
Maureen, if I can move the slide. Sorry, I don't have a. If I can go to the second slide, please.
Is this the slide you want?
Oh yes, I just wanted to go to the next slide, please.
Which slide do you want? Are you looking at
the one,
you already moved your slide way forward, so I don't know which slide you want. You have to tell me.
Sorry.
The slide on the screen right now is how the IT team is leading Colliery's Get IT Right.
Yes, indeed. Sorry, it took me a while, but yet, I guess I have been able to move forward. We are on the second screen. It's just that it is taking a while to refresh out here. So I wasn't too very sure whether we had moved the slides or otherwise.
Why don't you just keep going with your presentation? We will catch up with the slides. So if you know what you want to say, please go ahead and say it.
Sure thing. There were initially 3 participants who were supposed to be joining on this meeting. I'm not too sure about Ramdev and RK. They may have logged in from the other locations. So my name is Jagdish Puryanarayana. I'm one of the directors on PWT India board. I'm a first-time entrepreneur. Worked with companies like GE, Oracle, and others on a couple of service-related areas. And Logic Blocks, myself and another gentleman called Ashok, we have built this from the ground up. And this tool has undergone a couple of changes. Right now it's in a format which is a rich internet application flavor, basically.
So talk about what do you do? What is the value proposition of the company? What do you provide?
Oh yes, I have a couple of slides coming up which actually talk in detail about the same thing. So we are Logic Blocks is a commercial off-the-shelf knowledge management application. So it is completely available. You can buy it as a box and kind of start using it in your enterprise. It is available both in standalone intranet web application and cloud modes. It helps companies in retaining their knowledge around the business processes, IT systems, and other pieces. That's allowing companies to focus efforts on flawless execution and customer experience rather than talking about working on day-to-day issues. They are able to refocus their efforts on flawless execution. So we provide a knowledge management system that can be used by those people in actually building these processes and other things, which reduce the mean cycle times, reduce the defects and other pieces through which they are able to refocus efforts on this flawless execution piece that I told about. As part of this product, we provide extremely competitive total cost of ownership and good return on investment. A couple of things have been shown on this slide.
So what is the super app of your product? What use case do you do the best job of addressing in your customer base?
Yes. So these the product is a knowledge management related product, which means that it helps.
But knowledge management Knowledge management is not a, knowledge management is a pretty generic term, right? We have seen lots of knowledge management companies come and go in the history of enterprise software. So my question is, knowledge management companies that have been successful have applied knowledge management to specific functional problem areas, problem domains in an enterprise. So my question to you is, what particular problem are you solving with your product?
What areas we focus on? The areas that we focus on are the custom logic related maintenance and knowledge around these areas. The way we can positively influence innovation cycle related efficiencies and other things. How do we reduce the mean time to resolve? So we look at the tip-off diagram, or something that is generally used by the industry. The supplier input, process, output, and the customer, what eventually goes to the customer. We actually put it on a single plane, and we start delivering our programs. These programs actually lead to these benefits, what I have stated on the slide, which is 10 to 15% improvement on the mean cycle time and the custom related objective. I have one more slide wherein I'll be explaining this in more detail, and I'll just very quickly go over to that slide, which will be helpful in me putting up some kind of a detail. And I'll just have one more slide wherein I tell as to how we have been able to use this product at one of the customer locations, which will kind of set the thought rolling around what we actually do. And then I'll jump over to the other slide immediately.
Okay, keep going.
Yes, so Singareni Quadrants was where we implemented logic blocks initially. This was one of our early customers. Singareni Quadrants started off with the digitization related activities very early, something like 80s and 90s. And as part of each of their key programs and initiatives, they had amassed a lot of systems, and along with so many disparate systems, so many system issues as well. Added to this, the lure of big dollars and the kind of benefits that come with Tier 1 city like Hyderabad, Kotaguda, where this company is situated, has had its share of difficulty. So how we came in as we came in as the Oracle guys on this site. We completely overhauled the situation by bringing in logic blocks as a single data store. Working closely with their IT teams, we worked on some key objective areas for the management out there, like zero surprises, zero breakdowns, improved product revamping, reduction of all the defects, and timely reporting. So we brought in all these positive aspects, and we brought in savings around each of these areas. So the end result was that the employee attrition has stabilized. There is improved alignment. There is better profit because of this improved alignment. Employee attrition nowadays doesn't cause knowledge attrition. So that's one of the big objectives which has been achieved out here. So one more.
Interrupt you. Okay. I'm going to interrupt you. How many customers do you have?
We have 8 customers who have implemented the various versions of Logic Blocks, Sramana.
And how much do they pay you, each of them?
Okay. Yes. Most of these customers were the early customers who we just provided only the Logic Block piece. They already had the Oracle and the other things which we had previously bought from the other vendors. So they generally pay us between 2.5 to 5 lakhs for each of these software pieces, only the Logic Block piece, wherein the database, middleware, and the other things that they need to actually get this running is already present at the location. Otherwise, we sell the software in 2 specific things. One is a 10-user pack, which we sell around 30 lakhs, and a 25-user pack, which we sell around 50 lakhs. This is all the INR figures out here.
So, my impression, just listening to you for the last, 10 to 12 minutes, is that there is a lack of clarity in explaining what is the real value proposition. In the history of the software industry, numerous companies have tried to position themselves as knowledge management software companies, and none of them have really succeeded.
Correct.
So you are going to need to really zero in on particular problems that you solve using using whatever technology, whatever knowledge management technology you have, and package this software in a way that you can sell to hundreds of customers. The difference between a product business and a service business is that you want to build something that hundreds and thousands of people are willing to pay you for without huge amounts of customization. There may be 20–30% customization, but 70–80% needs to be a product that lots of people are going to be willing to buy. And right now, the way you have presented this to me, I just don't see how you're going to sell this to hundreds of customers or thousands of customers.
Sure.
Because if you're unable to articulate what is it that you offer, what is the value that you offer?
Sure. Just coming into the differentiator, we are actually we are filling the lacunae in the CIO toolbox. What is the lacunae that we are actually filling up? The custom logic and the other aspect, which actually defines as to how the enterprises does work or does interact with its internal and external stakeholders. This is over and above your ERP, CRM, or any other software that you generally put in. The custom logic is not, there is a shortage of products, or there are no products which generally maintain this kind of a knowledge. There are no products in the marketplace which generally do this. So our product actually helps us
knowledge management are in multiple different parts of the ecosystem. There's knowledge management applications to do with customer support. There's knowledge management to do with training. There's knowledge management to do with HR. There's various parts of the organization that have knowledge management applications. Unless you pick where you want to position your company, this is going to be all over the place, and it's not going to scale. You're going to have very, very long cycles for very small money.
Yes, we are just targeting only Oracle customers. One, we are targeting only those customers who are we are targeting Oracle customers only.
What customers? I'm sorry.
We are targeting only those customers who have some Oracle software that they have bought.
Yeah, but Oracle is very large. Oracle has products in every department. Oracle has a very, very large portfolio of products. So Oracle customers alone is not sufficient segmentation and definitely not sufficient positioning.
Indeed. The customers who have generally bought Oracle, they have put in a lot of investment and they are looking for extraordinary value. They have less knowledge on the best ways of using Oracleware, which is where we come in. We have created those specific knowledge base and other things and already loaded it on our website, which is componentminds.com and the other places, which we showcase as best ways of actually doing and implementing Oracle and providing this as additional support piece. So what we are doing, we are selling Oracle and we are providing logic blocks as an additional piece to it. How it benefits the people, they get to know how to best use Oracle software. And not only that, they also get to know what needs to be done and when it needs to be done. How the knowledge from the previous implementations and I think we give them completely free of cost along with the software, which is a good value proposition for them because they are able to manage their implementations, their other activities far better than they used to do it earlier. The problem was with the customers feeling that the training and the other pieces which would have helped them in this area are slightly pricey. They do not go through a training this thing every time. They need a system which will tell them as to what are the best ways of doing things, and they need this over and over again. So there is a lot of reskilling and
stop and listen a bit. I don't think I'm able to communicate to you that there is a problem in your company vis-a-vis positioning. You're trying to position your company as knowledge management on top of Oracle products. What I'm telling you is that's too generic. That's not a sufficiently tight positioning that is going to let you scale this company. You're asking what is the best way to increase scale. What I'm telling you is the way you are presenting your value proposition, this company is not going to scale. You really need to learn. This is the problem I see over and over again with Indian companies is you guys don't know how to position products. You have to learn how to position products, otherwise India is not going to have a product industry.
Okay. Sramana, the point is taken out here. I just took the details out. I have taken the notes. We will be positioning it slightly more differently, putting in more focus on what the differentiators are, which is what I could realize that is causing a challenge right now.
No, positioning question solve a problem. You don't know what problem you're solving. Knowledge management is not a problem that customers go out to look for solutions to. You need to, at a very granular level, you need to figure out what problem are you solving.
The challenges which we are trying to solve are the things that we have actually gathered from our industry experience, Sramana. So I have been in the Oracle arena for almost 15 years.
Look, I'm going to need to move on to the next presenter. Jagadish, stop for a minute. I'm going to need to move to the next presenter. I'm going to give you some logic, but I can't teach you positioning in 2 minutes. You need to figure out which industry's problems you want to solve. Figure out what is the specific problem in that industry that you want to solve. You want to figure out who are the customers who have that problem, and that's the only way you can scale this business and sell one solution to hundreds of customers.
Yeah, I get that, Sramana. Yeah, thanks. I have jotted down a couple of points with regards to this conversation wherein focus will need to be added to the kind of message that we are presenting. We'll have to actually fixate on one specific area or one specific problem that we are trying to solve. And we'll have to kind of change all our messaging around that to actually get to this specific problem. Right. So this is what I have actually jotted down, and I'll just possibly try to have a conversation with you offline, or maybe I'll try to send in an email and try to understand further as well on this.
All right, I'm going to move on. You should wait. I will finish all the presentations and I will talk to all of you about how we work with entrepreneurs on these kinds of issues. So hold on for a moment. You've taken good notes. I think the synthesis of the points that you just summarized is good. So at least we have the issues on the table that you need to work on. Let's get all the other people's issues and let's try to, identify what kinds of issues you guys need to work on, and then we'll take it, we'll go to the next segment where I will tell you about how we can help you. Thank you, Jagadish. Please put your line on mute. Manju, unmute your line, and let's look at what Swarmverse is doing.
Hi, Sramana. Good morning. Can you hear me?
Good morning. Hi, Manju. Yes, we can hear you.
All right. First of all, thank you for the opportunity, and thanks to everyone also for participating. I will not go through the slides verbatim. I will just propose our value proposition and what we are trying to do and how we want to scale. Primarily, Swarmverse is actually the company behind Scheme Central. Today, I'm going to be talking about our first brand offering called Scheme Central. Scheme Central is essentially aggregating a lot of jewelry saving schemes that have been existing in the Indian market, in the physical world, in the real world. We are trying to digitize all those schemes offered by various jewelry retailers, and we are trying to bring them into an online platform where consumers have the choice of participating in many of the jewelry schemes, and then merchants have the opportunity to kind of sell more schemes to their customers, and in turn that generates revenues for their jewelry sales. So that's
what is jewelry saving schemes?
Yeah, jewelry saving schemes are usually purchase plans provided by each individual jewelers. These are like people can actually put in installments month over month, and at the end of like 11-month or 12-month tenure, they can go and purchase the jewelry of their choice. Essentially, it's like a layaway or lay-by plan, which is used in the advanced or developed economies, in the retail sector. This has been practiced in India for about 30 years, primarily, but they used to have like a recurring deposit passbooks, which are paper and print based, and people come and sign up with a particular jeweler for a scheme which is 11 months or 12 months in tenure, and every month they used to get updated on their deposit passbooks when they make the installment, and at the end they'll go and redeem a jewelry ornament of their choice. So I
have a question here. This is a segmentation question. My guess is the people who use these kinds of schemes are people who are trying to perhaps save money for their daughters' weddings and stuff like that, right?
That is one segment.
So if you're looking at a segment that buys a lot of jewelry, that can afford to buy a lot of jewelry out of their own pocket, they're probably not using these schemes, right? The very affluent class of India, the upper middle class of India is probably not using these schemes.
That's not true. So what has happened is because gold has actually really gone up in its current value, it's become difficult for anybody to invest even in like 30 or 40 grams of gold. It's become a big ticket item. So what has happened with jewelers is just like how banks started with savings accounts, and then they moved to fixed deposit accounts, which has a 5-year tenure, and like the insurance accounts or insurance schemes, which is about 15 or 20 years. Jewelers also have started to kind of offer long-term schemes for planning, like you said, for it's like an investment mode right now. It's not necessarily savings mode. It started off being a savings mode, but it's graduated itself to actually attract a lot of different segments of customers.
Okay. So the point is that there are enough customers who are online savvy, willing to work with online offerings in your target customer base.
Yeah, I mean, if you look at it historically, most of the saving schemes used to be targeted for people over the age of 30 and above, primarily because that's when people start to actually have some, money in the pocket, and they're willing to kind of invest. But the new age crowd started to earn, at the age of 21 or 22, and they're also IT savvy. And the idea is nobody's looking at that segment specifically between 21 and 35. It's only when they're planning for the weddings, or when they're planning for, either their kids once they're born. That's the segment most people were looking at. We feel that the 21 to 35 segment has gone completely untapped, and we want to bring the essence of savings, to these people as well. So that's one large customer pool that is that we can address, combined with the other latent demand segments.
Currently does not do what you are proposing that you want them to do. You're trying to instill a behavior change.
That's absolutely true. In fact, one of our catchphrases is, we are trying to change the purchase behavior of people, where at least in jewelry, it's a planned purchase. You essentially can actually do purchase in installments and avail both the ornamental value of jewelry as well as the gold's appreciation factor combined. So that way, you are disciplined. The system is kind of taking care of all your monthly installments. It's aggregating in one place. You look at the reports. You have not missed your payments. There's a schedule of payments that's in there. So it makes you more disciplined, and it's kind of geared towards saving. So it enables people to change their purchase behavior.
My concern would be if you're going after a segment that doesn't do this today, it's not like you are bringing a segment that already is very familiar with investing in jewelry and or saving to buy jewelry at a later date, and you're bringing that process online. You're trying to go after a segment that is not familiar with that process, and that, to me, that's much harder to do.
No, the 21 to 35 is just one segment. The truth is, the 35 to 65 age group has already been doing it in the real world for a long time. So there's also that segment we are actually tapping, because we also have mobile solutions, not just online web-based browser solutions. There are different levels of segments in which we can look at, and also just offline aggregation of these schemes itself is not available right now. Like how, in a nutshell, if I would want to say, just like how Redbus in India aggregated a lot of bus operators, essentially we can aggregate a lot of these jewelry saving schemes and then bring the same efficiencies of scale to the jewelry business that Redbus did to the bus ticket industry in India.
Right, but I think there are two major segments that you are trying to address, and my suggestion would be to pick a segment that is already doing this, as opposed to bringing or focusing on the segment that is not doing it, and you need to educate them. I think you should let the jewelers do the educating, because they know how to do that educating. Otherwise, you're going to invest a lot of money in trying to bring customers on. And it's going to be, basically educating a market to do something versus facilitating a market to do something that is already doing this particular action, and making it easier for them to do it is what Redbus did. Redbus did not teach people to take buses. Redbus basically smoothened out a process that was already happening.
No, and we are precise.
Go and educate huge masses of people to take buses. But what you are talking about in the 21 to 35 segment is going to be educating a population to take buses, the equivalent of taking buses, which I don't think you need to do. You should let the jewelers do that, who are already doing it as part of their process.
No, you're perfectly right. So the latent model where, I'm not saying that large segment of 21 to 35 is not investing. I'm just saying mostly they go and invest in, or, not invest, but spend on flashy shoes or, flashy currently imitation jewelry, or, where there's not real value, because they have disposable income between 22 till 30 till they get married, and then they suddenly get into the savings mentality. What we are saying is
that it's a good thing for them to learn to invest. But I'm telling you that you should not be the one doing that education. That is not your business. Your business is the Redbus of jewelry savings, a jewelry investment, which is to facilitate a process that is already happening. That is where you should put your positioning. It's a very big difference. Try to go after the younger segment and try to educate them. Your business is going to be a very different business than what it's going to be if you're trying to go into a market that is already doing it. These are the subtleties of good strategy.
Yeah, so our customer acquisition strategy, that's why it's kind of, two-pronged right now. One is, for the jewelry merchants, we're telling them, hey, you know what, 10% of your current business comes, via saving schemes. We can take that to 20 or 25%. We bring you new customers from new channels, and you pay as a commission. And, you have a lot of existing consumers who want to pay online, and you don't have the systems or the facilities to do that. So we'll provide you everything on a cloud-hosted solution. So you get new customers, you pay as commission. The customer, free of any charge, gets to look at all his statement of holdings at any point in time, real time. Looks at getting notifications for payments, overdue payments, and all that. So that is one where through merchants we go and kind of acquire customers. The other one is of course organic.
I think there's some very strong flaws in the way you just described it, because your value proposition to these merchants should be that we're going to put this process together so that you can cater to your customers. If you tell them that you're going to bring them new customers, that means that you're going to have to go and educate other customers. And I'm saying that is going to be much harder to do and much more expensive to build a business around.
Yeah,
I don't agree with what you're telling your merchants.
No, I mean, then why would the merchants actually come and seed their schemes with us if we are not giving them new business? I mean, what's the incentive for the merchant?
We have no way of catering to these customers in any kind of, the kind of what did Redbus do? Redbus made it possible for people to look for schedules and book tickets online and so forth. It basically made a process that was highly manual and very low transparency into a highly automated and high transparency process. That's the value proposition why the bus operators decided to work with them. And that automatically created a certain amount of, extra visibility for them, and the word of mouth spread, and you kind of, now if you try to go and actually educate the market on the benefits of investing in jewelry, that is a different business.
Yeah, I think Sramana, I think there are 2 points there. Redbus also started as cost efficiencies and trying to tell merchants, hey, you're not essentially doing proper service to your customers, and we'll bring you the efficiencies. But the truth is, 2006 to 2007, that didn't scale, and then they were told that, hey, you know what, just sell 4 or 5 tickets out of the 40 tickets in a bus, and they're going to see that kind of scale automatically, and then they're going to come and ask you for the back-end efficiencies as well. And the truth is, we have taken the first approach directly, saying, hey, we're going to get you new customers from a new channel which you've never tapped. And then the efficiencies that we give you automatically will enable you to come to us for the other back office efficiencies that you're looking at. So it's 2 different ways of looking at it.
So business is a different business. If your business is to educate the market about investing in jewelry, that is a very different business. That is my point.
No, I didn't say that was...
Figure out which business is the real business.
No, I didn't say that 21 to 35 is the only segment. I just said that was one of the segments. So where we're going to bring in value.
No, that's not the point. The point is, depending on which segment and which business do you go for, the business changes, the nature of the business changes. I don't think, right now, because you don't have the experience, you don't appreciate how expensive it is to build these businesses. There is a very big difference. Asking people to take the bus and asking people to invest in jewelry are vastly different processes. The level of barrier is vastly different. The target market of people who take buses is much larger. It's a real mass market consumer phenomenon, taking buses. Investing in jewelry is not. You're going to have to find those customers who are willing to do it, who can and are willing to do it. Then you have to educate them to want to do it. I can assure you, psychographically, a 21-year-old is not thinking about investing in jewelry. That's just not how 21-year-old people are wired. Anyway,
No,
if you like it or not, this is my feedback. This is my assessment of your business. You can decide what you're going to do with it. We're going to move on to the next presenter.
All right. Thank you so much, ma'am.
You're welcome. Okay. Sibia is Anshuman Bhattacharya. Anshuman, are you on the phone?
Yeah, hi, Sramana, I'm here.
Go ahead.
Hi, everybody. Sramana, first, thanks for giving me this option to present before you, number one. And let me start with the background of the company that we have very recently founded. We are an analytics product company who purports to develop products focusing on marketing and customer intelligence management, which is relevant for the brand marketers and other companies who provide service directly to the consumers.
Is this for brand marketers?
Sorry, I can't follow you properly.
Is this for the Indian brand marketers?
Well, not specifically for Indian brand marketers. The solution we are building, it could be appropriate for any brand marketer in the world. However, the nature of marketing and the marketing dynamics of the marketing industry that works in different countries, we are looking at creating products which are geography specific. So the geography specific, what I mean is that we're currently building a set of products which would serve directly to the Indian and Asia Pacific markets. However, we should think of Western Europe or US markets, these products may not be appropriate. So while the foundation of the
also, the other thing that comes into account is that this is a very, very, very crowded market in the Western world.
Exactly. So I personally have worked in Western world in this analytics product industry, and I know it is very, very crowded. But
yeah,
just the opposite is where what we see in India or many of the emerging markets, that not only the products but the proper service of analytics is not available, and there are certain reasons of that. The markets itself, the data itself are not matured. The best practices are not there yet. So that's where we see there's a huge opportunity for us to bring in the best practices from the world and adapt that into the regional specific nature of the problem and create a solution out of that and start serving the market. This is exactly what we are currently doing.
Okay. Do you have customers in the process, Indian customers that you are working with to scope out what you want to offer?
Yes. So the couple of Indian customers we are currently working, we have not yet introduced the product. Then more of a servicing capacity. The idea is that the servicing capacity or servicing solutions will give us the experience to adopt the product rightly in the Indian market. Two of the customers with whom we are currently working, they have adopted our product to taste as an beta. That means we are providing the service and they are paying us for the service. However, after the service, the data and the process that we are generating, we are implementing that for them free of cost, so that they can also taste how the product performs and how much benefit that brings to their business, as well as we also get to learn from the market exactly what are the loopholes in the product and where we can improve upon that. So this is how we are operating. So the products we are currently talking about work.
My question is, what kinds are these?
What size of business you are asking?
What kinds of customers? What are these enterprise customers? What vertical? What types of what kinds of customers are these? How do you characterize those customers that you are that you're engaging with and that you're targeting? Are you there? Anshuman, are you there? What's going on, Maureen? Is there a problem with his line? Well, Anshuman, my feedback is that you need to decide fairly granularly whom you're going to go after. Is it the, automobile brand, for instance? Brand marketing for cars is one kind of marketing, and they have certain specific requirements of how they go to market and what they need to analyze. They may need to analyze dealer behavior. They may need to analyze television advertising analytics and blah, blah, blah. If you're going after retail, that's going to have a different dynamic. If you go after, some other area, consumer packaged goods, you're going to have to think through their requirements. So my suggestion to you is going to be to figure out what target segment you want to go after and get a good number of customers in that target segment so that you can have representative input from that particular target segment in a significant amount, in a statistically significant account, and you have, you know, wide-ranging feedback as opposed to just custom feedback from one customer. And don't go after too many different segments at once, then you will not have the synergy. It will basically become a services company. You will not be able to turn it into a product company. Okay, so we're going to move to the next presenter. Anshuman can listen to the recording.
Hi, this is Anshuman.
Anshuman, I just gave you a whole bunch of feedback. You will need to play the recording to listen to it. Do you have a target or segment that you're going after?
Yeah, we are at this moment primarily going after the Indian mid-sized companies, and by mid-size I mean the national companies who are not the multinational branches of India like PepsiCo or Kellogg's, but we are going for the Indian companies like Dabur and Kevin Care and Godrej kind of companies who have not tested the base of analytics yet, and we're trying to provide the service through our products to this segment.
So I see a slide here. You have all these different segments listed: retail, CPG, FMCG, retail banking, credit cards, insurance. Don't try to go after this many segments. Try to go after one segment and get lots of customers in one segment so that you can actually design a product. Otherwise, you're going to be a service company building custom products for each of them.
Yes, I mean, we also realized that, and that's why we're kind of now focusing only the brand marketers in the CPG and retail area.
Okay, so, and again, CPG and retail are going to behave differently, so pick one and focus on one of them.
Yes, right.
Each of these segments are big segments, and each of them have a different workflow. So analytics, what gets analyzed is very different from segment to segment. So you really need to pick one segment and build a product for that segment. Otherwise, you're going to be a services company. In India, people tend to have a very big difficulty saying no to anything. And part of the trick of building a product company is to say no to things that don't fit in your strategy. That's how you scale something. Okay. We're going to move on to the next person. That's still you, right, CBL?
Yeah, this is Dr. Puneet Kamra. Good evening to the Indian friends, and good morning, Sramana and Maureen.
Yes. What's the name of the company, Puneet? Be Secure, okay?
Be Secure.
All right.
So, Sramana, this is a concept which is embracing the public safety as well as the healthcare aspect, which is a very, very prevalent cause of concern in the developing countries. So we are targeting the segments which are basically in the developing countries. The concept, the foundation falls with starting with an emergency management system, which has an integrated element into it. So if you can just go to the next slide, please. Next one. Another one, please. The next, please. The next. So, Sramana, this is the core of this business. Is basically you are targeting a single unified number which is going to address all your emergency needs, whether it is a police emergency, medical emergency, or the fire emergency. So the startup is with this, and you can build in a whole amount of ecosystem which is catering to the healthcare management system, which can add into the remote patient monitoring, vehicle tracking, patient tracking, cashback tracking, child tracking.
Explain to me, who is the customer? Who buys this system?
So customer is the individual citizen, as well as the government, as well as the corporate who can ensure the security and the healthcare management for their employees.
That doesn't work. Who pays for this? There is one entity that pays for it. Who is that? Is it the individual consumer? Is it the government? Is it the police? Who's paying for this?
So it's actually going to be the citizen who is going to pay for it. And these citizens can be clubbed into various pools, whether it is a corporate entity which can pay for the whole employees, whether it is a government who can get into a rural or the area which is underprivileged, and they can pay for running the operation, or in a public-private partnership.
You have to make
but
something.
It actually
cannot see the minute you say all these things that these guys can pay and that guys can pay and that guys can pay, you're not going to be able to build a company around those kinds of all unconstrained options.
Sure, Sramana. Actually, to start with, it's going to be individual.
Right.
Sorry, I didn't hear the last one, please.
Then that sounds like everybody and their mother can pay for it. You have to decide what is your business. Are you going to sell to corporations and tell corporations that we provide all emergency needs for all emergency protection for all your employees? That can be a business potentially. If the rest of the needs, then you need to go talk to corporations and validate this value proposition with corporations. Are they willing to pay or not? That is one way of business.
So, Sramana, we are approaching it two ways. Yes, we have done validation. So, we are trying to approach this business model or business proposition in two ways. We are not taking the government sector right now. So, we are going to reach out to the individual families either through RWAs or resident welfare associations, or through the campaigns which we are trying to offer. Secondly, we are approaching it to the corporates for their employees. So these are the two ways we are right now focusing on selling this business proposition.
And my feedback to you is don't do both of them. Do one of those. Because consumer marketing is very expensive. How much capital do you have?
Capital is that what we are studying for, to be honest with you. And we would need definitely a funding to
big campaigns on consumers. You're going to have to create some level of validation of your concept, and in this case, the most likely path through which you might be able to get that validation is by working with corporations, establishing that they are willing to pay for this service, and figuring out what is it that they're willing to pay, and trying to see if that validates or not. Without validation, you will not be able to get access to any capital whatsoever. So do not create, kind of pie-in-the-sky kind of ideas of we're going to market to consumers and build a brand. This is just not going to work. The success in entrepreneurship lies in being pragmatic and knowing what you can afford to do without depending on investors, because investors like to come to the rescue of victory. Once you have established that your concept works, that you are able to prove to investors that here's a set of customers that are willing to pay for what I'm offering, that's when investors are willing to invest.
So this concept is not new, Sramana. What we have done is we have tried to build an ecosystem which is going to cater onto the various steps based on the needs. So this concept has been there in the market as you rightly knows 911, and in some of the philanthropic states in India is 108. So what we have tried to do is we are not.
911 is not a commercial service. 911 is a government service. It's a public service.
Yes, I know. 108 is also a public service, which is a PPP model. What we are trying to do is we are trying to build in an efficiency which can get directly to the citizens or the corporate employees, and with a very much better efficiencies on the peak, because the golden hour is going to be the same.
But the problem is that people are not used to paying for it out of their own pockets. A public service is not something that you can automatically bring to the private sector and tell people that, hey, you've got to pay for it and we're going to charge you for it. It doesn't work that way.
Sure, but if you add on the security needs and if you add on the healthcare management needs, say for example, just to give you an example, there are a lot of cases which are happening in India, especially pertaining to a threat to the women's security. So what we are trying to offer with the emergency management services is a gadget which is going to be an entry barrier for most of the competitors, is that you press a button and we know how to locate you because you are already on our radar. We are going to provide you the services, whether it is the police, medical, or whatever, at yours, wherever you are when you press a panic button.
Yeah, we've seen other business plans like this, but you are trying to say that it's a very easy thing to do. It is not. One, it's not an easy thing to do, and two, it's not an easy thing to get people to pay for. You have to decide where you get the money from. Corporations are not paying for 911 services. It is not part of their budget today. And consumers are not paying for 911 services. It's not part of their budget today. So you're trying to get wallet share from either consumers or you're trying to get wallet share from corporations. Either way, it's something new that they're not used to paying for.
Yes.
And there is already 911 equivalent. So what is preventing them from saying, oh, there's already 911, that's all we need, we're not going to pay for extra things. So that is the delta that you need to close, or going to need to close, is you're going to need to talk to corporations and decide that here's a set of services that corporations are willing to pay extra for and they're willing to pay you for, or you're going to have to convince consumers that, or validate with consumers that they are willing to pay for it, one or the other. I don't think you'll succeed in doing both, and you will not be able to afford to do both. And then the other point is marketing to consumers is a very capital-intensive game.
Yes.
Okay, so
we are in.
Go figure out who's willing to pay for what.
Sure, we are in advanced talks with some of the corporates. So, Sramana, we are in advanced talks with some of the corporates, basically from the angle of women's health and safety point of view. But they are also trying to get the services from the emergency management services also. Why? Because in India, there is still a very fragmented service provider space. If you have an emergency which is pertaining to both, whether it is the police and the fire and the medical, so you have to keep on dialing various numbers. What we are trying to do, if a corporate employee is having any kind of problem, they just need to dial one and we take care of all the service providers to reach you within a specified time frame. So that concept is like everyone.
It is not a question of convincing me, Puneet. You're going to have to convince people who are going to write you the checks. See, our philosophy, and this is, by the way, for all of you to appreciate, it doesn't matter whether I think it's a good idea or not, what you're trying to do. The only thing that matters is whether your customers, target customers, are willing to write checks to avail of your service. That is the notion of a business.
So, Sramana, when I have reached out to consumers who are basically the families, not the corporate employees, they are willing to pay because the size, because the funding which we are wanting from an individual family is very, very small. But if you look at the volumes, if you are able to cover even a small percentage of what we are targeting, then it's actually a huge revenue.
Okay, if that's the direction you want to go, then you have to figure out a cost-effective way of acquiring those customers. You can't go knocking at everybody's doors.
Yeah. So, I don't know whether this is
consumer business primarily, then you need to figure out how to structure it as a consumer business and affordable customer acquisition strategies, validation strategies, and so forth.
So, Sramana, we initially thought of a consumer business, and as you rightly said, it's not a very cost-effective model. So that's how we transitioned into the corporate, because there we get a complete volume from the employee's perspective, and there our spend on the sales and marketing effort is much less.
I understand that.
That's how the business model has transitioned.
If you are not willing to pay, then that is not a viable strategy.
Yes.
Somebody will have to pay, and yours will have to be predicated on a a target customer. It's either a B2C business or a B2B business. If it's a B2C business, you need a affordable customer acquisition strategy, consumer customer acquisition strategy. If it's a B2B business, you need a business segment that is willing to pay. That's the crux of the issue here. One or the other.
But Sramana, the beauty of this business model is it can embrace both B2C and the B2B. I know these are altogether different aspects from the business point of view, but the value proposition is to reach out the end customer, whether it is a B2C or a B2B. Because
but that is not my point. My point is somebody will have to pay. Who is going to pay? If you're going to go to market through the businesses, are the businesses willing to charge the consumers for the service? Maybe subsidize somehow.
Sramana, what do you suggest on
have businesses to figure out how you're going to go to market?
Sure.
Okay, I think I've told you what what my observations are. The rest you need to figure out how you put those things together.
Sure.
Akash Rajpal, you're up next.
I'm on standby. Let me know.
Go ahead.
Yeah, okay. Hi, this is Dr. Akash Rajpal. I'm from India, and I'm the founder of EcoHealth. And the bottom line, what EcoHealth does is tries to reduce the family healthcare costs. Next slide, please. Next slide. So what we are is basically a group purchasing organization which aggregates a lot of services. The biggest problem in India is because the marketing for hospitals and pharmaceutical companies, laboratories, etc., technically is not allowed by the Medical Council of India and the government. It becomes challenging for the healthcare entities to reach out to customers in a cost-effective manner. So what happens is that it creates a lot of dependence on the referring general practitioner who charges a lot of money to send that patient to the healthcare provider, and this increases the healthcare costs. So what we do is we aggregate all these services without taking a referral fee and give out at the lowest margins for the hospital to these patients. And this works on a subscription basis. So contrary to everybody saying that the patient should not or the customer should not pay for such healthcare facilities, we charge the patient. We charge the person who is in need of reducing their healthcare costs. And each person then has an access to the service through our services. Next slide, please. So what is the target need? Why EcoHealth was started in the first place? There are various research reports. I can cite all of those, but typically out of all that, about 119 million Indians with a family or with a monthly income of 5,000 rupees and above need some kind of a surgery, need some kind of chronic medication. On an average, they have a medical expense which can range from 500 rupees to even 10,000 rupees per month. And these are the people whose monthly income is just 5,000. And why the figure 5,000? Because this just crosses them beyond the designated below poverty line technicality in India. So that means if they are above 5,000, that means they will not get any government support, they will not get any kind of a government funding. And these are the people who are just entering the middle class population, and many of them even do not like to go to a government hospital because it is overcrowded. So much of the dependence then is on private healthcare sector, which is anyway 80% of care in this country. Out of these 119 million Indians, there is hardly any kind of an insurance penetration. Per se in India, the insurance penetration is not more than 1% of the population, and this is the IRDA's official figure, the insurance regulatory's official figure. But if you take into account any government scheme, or you take into account the corporate sponsorship or the employer scheme, the total insurance or the sponsored healthcare is not more than the biggest other problem is that if these people are able to afford insurance, then 35% of insurance application is rejected because these people have some kind of a excludable problem. They either have some surgery requirement or they are suffering from some disease. So therefore 35% of insurance applications in India per se are rejected. Somehow if that gets filtered, the average rejection rate in India for applications after the person is insured when he applies for reimbursements for medical expenses is 35%. So 35 people out of every 100 insurance claims again get rejected. So this is a great problem, and this is the exact target segment we try and reach out to, because they do not have any kind of financial aid per se to reduce their out-of-pocket expense. This problem is further aggravated because the dependence is too much on the family physician, and the referral fee, which is unethical, is as high up to 60% of the patient's bill. So typically a patient will pay if he's not aware of the real costs or he's not informed on the costs. He would be paying an inflated bill of 60%. So that is where EcoHealth comes in. Next slide, please.
So just a second, before you move on from this slide, you have all sorts of things here. Target population, heavy users of internet and social media. 119 million Indians, especially this 5,000 rupees per month category, those are not heavy users of internet and social media, right?
That is not. That is why I did not want to speak. What I was trying to say is that is the immediate target population. But how do we reach out to that target population is because of social media and other aspects where the social media usage or the internet usage is rising. And believe me, and you will be surprised to know, even my driver who falls into this category uses WhatsApp to communicate with me. He uses internet and emails to communicate with me. So it's now not surprising to know that this population, even in that socioeconomic segment, is rising. So and we have got this validated. There are a lot of people, even in that socioeconomic segment, which use internet. For example, the retail segment, the mall, which employs the counter staff, etc., who sell you groceries, etc. When you go to the mall in India, the average salary of those people is about 5,000 to 7,000 only, 5,000 to 7,000 per month, and they fall into this category. And they are very heavy users of internet. They have smartphones, though it may cost them only 2,000 rupees, but they use internet. They communicate, and this segment is rising. So therefore, this is a valid thing for us to reach out to that population, primarily to acquire a customer.
And how much are you charging these customers? What is your assumption about the monthly fee?
The subscription is annual, and the entire family pays as a subscription. So we don't sell it to a single individual, we sell it to a family. So typically we have calculated that as a family of 4. That is how an Indian family typically is, and we charge 1,500 rupees or $20 per year for the entire family.
So 1,500 rupees to the family, and let's say we're talking about this 5,000 to 7,000 rupees a month kind of family.
Yeah.
What segment are you going after? Because I think the math becomes quite tricky, because let's say they pay 1,500 rupees a year subscription fee, but I mean, they can't really afford to pay a whole lot.
Yeah, it is just about 6 rupees a day. That is what we are talking about, 6 rupees a day per person. So 1,500 rupees.
Listen to the question and answer the question. The question is based on, at what income level can people actually afford to pay for medical treatment of the kind that you're talking about, the surgeries and the specialists and so forth?
See, when it comes to surgeries and medicines, there is no escaping that. So they would take loans, they would take advance salary, so they would do it. And many of them who have parents with increasing lifestyle diseases, they would have to spend on hypertensive medicines, etc. So there is no escaping that. So this they spend. Even now, many of our member segment, which I'll be talking about, even when they are into this segment, they spend that much money, and that becomes very challenging for them, especially when they spend on inflated bills. So this 1,500 rupees is a is the higher side of the amount which we take. Depending on how much bulk of customers we acquire at one time, we even charge only 400 rupees per family, depending on how many people we get together at one time. So that is the amount on an average which we charge, and these people require and are willing to spend that much money per year to save. And our average saving is 22,000 rupees a year. So it ranges between 8,000 to 22,000 rupees a year. So if they spend, even at the higher side, 1,500 rupees per family, or it is 300 rupees per person in the family, they would save per family 8,000 to 22,000 rupees a year. It's a great return on investment for them, and they become more aware. And the savings actually, when we calculated, is much more than this. For example, recently there was this patient who was told that an angioplasty should cost him 4 lakh rupees. But when he came back to us, we told him that your angioplasty at the lowest level cannot be more than 80,000-90,000 or even a lakh of rupees. You're spending 4 times more. And when we gave him all the reference bills, etc., and when he went to the hospital, he saved that much money. So that is the kind of savings he had just by subscribing to us. Okay. So our mission basically is to provide healthcare cost safety net, especially to the unsecured segment who is not insured, and primarily who will never get insured. So senior citizens, cancer patients, renal dialysis patients, diabetics, hypertensive, these are the people who will never get insurance typically per se in India. And this is the snapshot which you see. Can you just be slow on the slides, please?
We are going to need to finish in about 2 minutes. So
okay. So just go to the snapshot. Yeah, this one. So this is a summary of what we are. So our target segment is 60 plus age group primarily, though the entire 919 million is the target population. But this becomes our priority target population. The reasons are there is low insurance penetration, there is insurance rejection, and there is an increased prevalence, and the prevalence of chronic diseases, and there's a huge dependence on unethical referral fees and doctors who would guide the patient to higher paying centers. So that is why Equal came into picture. Next slide, please.
But the 60 plus age population segment is not the highly connected segment. The highly connected
It is not. That is why it becomes a great challenge for us. But they are in the biggest need for us, and many of our patients have joined us through senior citizen associations who are better informed.
And these corporate bulk purchase programs also won't work because most of these people are retired.
No, the corporate bulk purchases actually is working the best for us. I'll talk about it. Okay, because the thing is, when I say 60 plus is our priority segment, because that is where they will never get insurance because they've crossed an age group and they have the highest medication spend. So that becomes a target population because they will find this to be of the greatest need, which got validated. But there are other younger populations who are working executives, working employees who also suffer from diseases or support their family members who are 60 plus. Therefore, the corporate bulk purchases, because we go to not to the individual but to the family through those employees. So our member acquisition strategy is corporate bulk purchases, where we go out to employees to reach out to their families who may have those 60 plus people in their homes. Then we go through reseller programs, basically people who go to the pharmacies or chemist shops to buy medicines, and many of them require this because many of them take chronic medications and the chemist shop knows who requires what service. The insurance agent reseller network, because he knows whose insurance is getting rejected, and primarily the reason for insurance getting rejected is that they have some chronic disease and they have a huge out-of-pocket expense, and suddenly they have now an avenue to reduce their healthcare costs. Then there is affinity program like universities, associations, senior citizen associations, who can tell or be an influencer to such families or senior citizens, or as a value addition to the other healthcare services they may have. And other is brand-driven acquisition, which is completely free to the consumer, where it is corporate sponsored. For example, 1M can sponsor us. We will put your logo there and we will give it free to your desired target population and they can use it. So that is completely free to them, and that bulk cost is much, much less.
Yeah. So I think your assessment that there is a gap in the market and need of services is absolutely right, because the insurance penetration in India is very pathetic, really. And so I think where you're coming in, and these buying club types of programs have worked elsewhere. Costco is a great example of of buying clubs. So what is the current status? How many consumers are subscribing to your service right now?
So we have two aspects. One is a service provider or the aggregated aspect. So we have more than 2,000 participating service providers, which include Apollo Pharmacy, Health and Glow, Seven Hills, Medanta. All these people would give reduced negotiated, pre-negotiated rates or over-the-counter discounts for out-of-pocket expense for patients who would show their subscription card. And we have 2,500 individual patients which we have acquired in the last 3 months. And it has been validated, and Future Group has joined us. The Retail Association has joined us. Train Retail Association has access to 6 lakh counter staff whose monthly income is about 5,000 to 7,000. And we have an SMS and an iOS app which we are ready to launch. So we are in talks with Airtel and other companies to launch this as a free service to people where they can get generic substitution. One of the biggest service which we give to a subscriber is that they will give us a list of medications which is usually more expensive brand, and we will immediately tell them which other manufacturers are there, and they save almost 50–60% of the cost by just changing the manufacturer. And this we are launching through an SMS for people who are not app savvy, and iOS app for people who are more app friendlier, etc. Because many of my senior citizens today, members, are actually on iPads, even though they are in that segment. Believe me,
Here's I'm looking at your challenges. Your idea is interesting. Definitely, it's catering to something. My suggestion would be to really get specific on the segmentation, and instead of getting enamored with 119 million target customers, figure out what is the 1 million segment that is really ready and accessible to go to subscribe to your solution. Forget about the 100 million.
Yeah, which we have identified primarily as the corporate bulk purchasers, the employees themselves. So that is what
Focus on that. Forget for the time being.
Yeah, can I see the challenge slide, please?
You have the challenge slide. It's on your screen.
I'm not able to see it. Okay, yeah, got it. So these are my challenge slides, and I would request all participants, including you, who can give us an insight as to what we should be doing about it. So, can you hear me?
Basically, focus on your corporate segment and carry on from there. We need to move on to the next segment. We're going to wrap up in the next 10 minutes of the presentation, but I think you have something interesting going here. Can hold on for a second. I will talk about how we work with people, how we work with entrepreneurs in a few minutes. So folks, I am not sure if we will have time to do call-in questions after this. We are kind of coming to the very end of the budgeted time, but nonetheless, if we do, here are the numbers, and you should put in the public chat that you are planning to call in, and I will try to take a few questions from the audience, either through public chat or through the phone line. Meanwhile, I'm going to spend a few minutes, about 5 to 7 minutes, telling you about how we work with entrepreneurs, and then we're going to do 5 minutes of Q&A and finish the session at 9:30 a.m. Pacific time, which is our target. So if you like what we do, this is a very, one thing you will notice is that it's a very frank feedback session. We're not trying to tell you what you want to hear. The whole purpose of this is to brainstorm about how you can make your project successful. And that includes preventing you from making unrealistic assumptions. Understand one thing, that if you are after investors, if you are looking for capital, and if you're making assumptions that capital will be available for you to achieve your goals, that assumption requires that you provide validated businesses, because nowhere in the world today are investors willing to invest in unvalidated businesses. If you're working with unvalidated ideas, you have to bank on your own savings or your friends and family capital. That's the only kind of capital that you'll be able to access. Where the minute you get to institutional capital or professional investor money, you are going to need to have validated businesses. So one of the things we focus heavily on is to get you to, something, getting you to a set of milestones, a strategy so that you can take something, you can bite something that you can chew, and you can get to fulfilling certain validation criteria with which you can then get to the next level, be it getting to revenue, be it getting to investors and capital. That is the way to do it. We kind of try to guide you to put one foot before the other so that you don't get rejected out of hand and then splatter. The whole point of being a successful entrepreneur is to build value step by step and be able to put one foot before the other and make progress. So that is the philosophy of the program. If you like that philosophy, if you like the approach of being candidly and safely focused on your progress, please help us spread the word and bring more entrepreneurs to use this service. 1 million by 1 million resources, I will give you a quick overview here. Everything starts at 1mby1m.com. That's the website. You will find the blog very, generously sharing case studies and knowledge on how to build companies, trend information, role model, case studies, and so forth, which help you learn. We do teach the whole program on a case study-based philosophy. The Entrepreneur Journeys book series, we have published 4 volumes of it. Each of them are 12 to 16 case studies plus analysis and synthesis of specific types of strategies and things that you need to learn to put one foot before the other. You will hear me harping continuously on bootstrapping and positioning. Today, every single business that we talked about, all 5 businesses that we talked about, there were tons of positioning related issues that I picked up. Positioning is one of the worst understood topics in startup land. And we continuously see companies that have lots of positioning problems, lots of segmentation problems, value proposition problems, pain identification problems, which prevent them from being successful and scaling rapidly. You cannot scale anything rapidly unless you can zero in on your positioning. So, that is one of the core philosophies of 1M1M is that you have to position very tightly, very sharply, and you have to bootstrap the early stages. Investors ideally would like to come to the rescue of victory. So you have to create a situation with your bootstrapping strategy so that you can then present something where a lot of risks are mitigated and investors can feel like, okay, yes, now I can take this and scale it. And that is the reality of the game. The startup game is played this way today, and the ones who are succeeding understand that game and are willing to do what it takes to succeed in that game. It is not because I want you to do something. Everything I'm telling you is a reflection of the state of the market. This is what the market wants. It is not my preference. It is not my, whim. It's basically a reaction to how the market operates. Okay, the blog is, by the way, at sramana.com. You can access it through 1mby1m.com as well. We also have these free strategy roundtables every week. This is our 169th roundtable. Thousands of people come to these sessions over the years from all over the world. We coach entrepreneurs at both these public sessions as well as in our private roundtables, which is part of the premium program. These free roundtables, you can register from the website. On the top left corner, you have free public roundtables. In the navigation tab, you can register for all the sessions, both to pitch and to attend. And then we have the premium program, which is a $1,000 annual membership fee for extensive methodology guidance. We have a case study and video lectures-based curriculum to teach you some of these subjects like positioning, like bootstrapping, like customer acquisition strategy. Cost-effective customer acquisition strategy is something that all of you need to really understand deeply. Otherwise, you will not be able to do the bootstrapping bit to be able to access additional capital. So these are vital pieces of learning how to put one foot before the other. In the cases where we have our network overlap with your target audience, we help you with business development, introductions to customers, channel partners, and of course, if you are fundable, when you are fundable, introductions to investors. We provide similar kinds of strategy consulting in the private roundtables, and we have extensive clout in the media, and we help you with that as well in helping you get coverage and visibility, which is an essential piece of go-to-market strategy. You will meet some of our $1 Million Club members if you go to this link. It's, again, accessible from the homepage itself. Quantifying the 1M1M value equation explains the 1M1M ROI. We provide $375,000 a year worth of value for a $1,000 annual membership fee. So we are a subscription-based program. You can subscribe and become a member of the 1M by 1M Club, so to speak, and access unlimited, all those value vectors. And we provide you orientation material on how to use the program effectively. We recommend that you take the self-assessment to help you calibrate your business against the typical issues that people run into, and that if you're after capital, you will have to be able to address these issues. It's free. You will find that on the website, and there are curriculum modules. If you are a premium member, there are curriculum modules attached to each of these elements, and you should be able to access them as well. If you're the curriculum modules through the 1M1M self-assessment page. The premium program is described in great graphic detail in the website. You will be able to access what to expect from the premium program, the video FAQs and so forth, all from the site, which will help you evaluate whether you want to use this program to help you put your ducks in line. The curriculum is taught as a combination of case studies and video lectures. We have the best collection of case studies in the world in the early stage technology and technology-enabled startup services area. And this is basically what you get to access through the program. We have brought hundreds of entrepreneurs to share their success strategies with us so that you can learn from them, and then we have synthesized all of that in form of video lectures addressing all the issues that we have seen come up. Remember, we have done 169 of these roundtables, as well as hundreds of private roundtables. So we have a deep understanding of what kinds of issues you are facing, and we know how to help you mitigate those issues and tackle those issues. And we have created this curriculum so that you can learn how to mitigate all these issues that are coming up. In the core curriculum, you will learn 7 topics: bootstrapping, positioning, market sizing, customer validation, financing, customer acquisition, and team building. You have to learn all of these issues. You cannot be a successful entrepreneur without learning all of these issues. So you may as well learn them as quickly and as efficiently as possible. And that is our goal, is to teach you as quickly and efficiently as possible all these issues. On the elective side, we teach you the different areas where we see the maximum amount of businesses these days: Web 3.0 and e-commerce, cloud computing and business solutions, outsourcing and consulting, mobile and social apps, healthcare IT, online education, gaming. All of these are areas in which we have experience as well as material to teach you domain-specific strategies. Our methodology is lean, capital-efficient, bootstrap startups. We will never lead you down a path where your strategy will be to raise $5 million out of the gate, because the chances of that strategy succeeding is minuscule. So we don't lead you down low probability of success paths. We try to help you mitigate risk and make sure that you have a chance at being successful, so that you have, strategies, you create strategies that can translate into results without depending on external forces like huge amounts of capital. If you go to the press page, there's coverage of premium members. We try to give our premium members a lot of visibility, so you should make sure that you have access, you take a look at that to get a feel for the kind of visibility and PR that you can access through the program. We also give you access to our social media channel. The social media channel flows through Twitter, Facebook, LinkedIn, all of them. Our Twitter channel is about 8,000 people. Our Facebook channel is over 16,000 people, and our LinkedIn channel is almost 14,000 people. So it's plus we have the blog, we have an email newsletter that is about 34,000 people. We have many ways of giving you access to, audiences. And if your audience aligns with our audience, we encourage you to use these channels to be able to get your message out there. So these are, some of an overview basically of what we offer. We do have an affiliate program. If you're doing entrepreneurship development, you're welcome to be a partner. And every week, basically, we have roundtables, these free roundtables. You're welcome to continue to use them. And also, please do help us spread the word. Every week in April, we have one of these roundtables. So we are almost at the end of the session. Vision India 2020, by the way, is my fifth book, which has $45 billion business ideas, and you're welcome to take any of them and implement it. Reminder, Startup Focus, FFP Startup Focus, 1M, 1M Partnership, scholarships applications are due on April 19th. So if you are planning to apply, please make sure your applications are in on time. And I don't think we have time to do Q&A, but if you really want to dial in, go ahead and let us know in public chat, and we will take 1 or 2 calls. Okay. In terms of getting in touch with us, I see some people asking how to get in touch with us. We would like you to get in touch with Irina Patterson, who will be your primary contact point. Irina, if you could put your email ID, Skype ID, as well as phone number on public chat so that people know whom to call and how to reach us, that would be great. So Irina's email ID is irina@1mby1m.com. Her Skype ID is Irina_Patterson. There you go, Irina_Patterson is Skype, and she'll put the phone number in just a moment. She is your contact person to ask your questions. Her phone number is 786-301-2456. So use any of those mechanisms to get in touch with her, and she will help you navigate the program and make your decision on whether you want to join 1M and use us as a support for your entrepreneurial journey. So that's pretty much it as far as our program is concerned for today. Is there anyone who want to ask questions? Shlomi, you're absolutely wrong. There are tons of people in the room right now. If anybody has any quick question that you want to ask, I will take a few minutes quickly to answer questions, because we've had a packed session today and we haven't really been able to do any Q&A, but we are pretty much out of time. No questions? Irina's Skype ID is Irina_Patterson, folks. Shlomi, if you want to talk to her, you should go ahead and touch base with her on Skype or email or phone. And if you had signed up to pitch today, we were completely oversubscribed today. I think we had something like 35 people registered to pitch today, and we only had 5 slots. So we will be in touch with you. Maureen will be in touch with you, and she will try to find you slots in the upcoming sessions. Okay? we try our best to accommodate as many people as possible. There you go. Irina's email ID is irina@1mby1m.com, Irina_Patterson on Skype, and the phone number is 786-301-2456. There you go. Everybody got that down? Okay. Very good, everybody. We will talk to you soon. See you next week. Hope you enjoyed the program. Bye, everybody.